Oh no! Wipe out. All right. So what happens when you wipe out? Sometimes you gotta go to the hospital. Now the thing about the hospital is they usually put an IV in you. When you get an IV in, you're gonna watch for air embolisms, and that's what we're gonna talk about today. So with air embolisms, you want to make sure the air isn't getting into your veins or your arteries. Your veins are going to be taking blood away from your heart, or excuse me, your veins are going to be bringing blood back to your heart. Arteries are taking it away from your heart. So you can go ahead and get up there for me, please. So when you get in to the hospital and they put an IV, let's say the IV is in your left arm. Now when they put a medicine in your IV, this is what they call a plunger. So the medicine is going to be in the plunger. When it's in the plunger, you want to make sure that your plunger is down when you're administering your medicine. So if your plunger is pointing up like that, air can get in because of gravity. And then when you push the med, you're also going to sometimes push air. And that's a no-go. So, can you tell me which way do I want to hold my plunger?
Plunger down.
Bingo. The next one is going to be IVs. So IVs are going to be medicines that are hanging. Gravity is going to be taking the medicine into your body. The big thing to remember is when you're setting up the IV, you want to make sure there's no air running through that IV, the line. So to do that, once you have the IV set, you're going to let the medicine run through. Once you see the bubble come out and the medicine starts to get to the very tip, that's when you know that all the air has been gone. If there is still air bubbles in there, you can go ahead and knock them out as the medicine's going through. They're not as serious because this is going into your veins, so it's not really that much of a problem. Now where it becomes a problem is, say you have a skateboard accident and you hit your head. If you hit your head, a lot of times they're going to put a PICC line into you, and that's going straight into your artery. When that happens, there's a lot more chance of an air embolism coming in. So in order to prevent that from happening, they're going to put you in reverse Trendelenburg position. That's with your feet down and your head up. The thing is they want to avoid is sitting position. So we used to do those surgeries just sitting. Now we want to do them laying down so that we don't get those air embolisms. Now if the surgery is below the waist, you're going to be in traditional Trendelenburg position. When that happens, your head is down, your feet are up. And then they do the surgery, gravity is going to pull all the blood down. So, can you tell me what's something you want to watch out for in the IV line? Air bubbles, perfect. And what position do you want to be in if you are getting surgery on either your lower body or your upper body? Let's say on your lower body, which position? No, that's the traditional. There we go, perfect. All right, well, thanks for your time, and can you introduce yourself?
I'm Viviana.
All right.